Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for January 9th, 2022. And our top story today, the link between mental health and dental health. Joining me now to discuss this and a lot more, Dr. Susan Albers is a clinical psychologist at the Cleveland Clinic. Susan, so great to see you. Thanks so much for joining us on the program this morning.
Thank you so much for having me.
And this is a great follow-up. Last week I was telling you in the green room, we did a show on proper brushing and flossing technique. This is a perfect segue because a lot of people don't align that the full body health, the mental health is often tied to our oral health. And I know you in the Cleveland Clinic tackled this topic. So how are mental health and overall health tied to dental health?
You're right. People are often surprised that your overall mental health impacts your health in general, and particularly your oral health. Dentists are sometimes one of the first people to pick up on mental health issues, and they actually make a lot of referrals to therapists because the health of your teeth and gums gives us a little bit of a clue about your stress level, your anxiety, even the way that you eat. So when you open up your mouth and look inside, it actually gives quite a picture of how your mental health might be doing.
And as you work in your practice and at the Cleveland Clinic, I would guess just by reading popular media that stress levels are on the rise. I mean, a lot of people are feeling stressed because of school, COVID, finances, etc. Have you seen an increase of cases where people are just really anxious, but also have maybe some bad oral health? And I know you don't necessarily look at their teeth, but I would imagine there's a connection there.
People who have high levels of anxiety, for example, and in our world right now, people are experiencing high levels of anxiety. We often hear complaints about jaws feeling either tight or very painful. And when you have high levels of anxiety, people often have sleep problems and they grind their teeth at night. So if you wake up in the morning and your teeth are feeling very sensitive, it may be reflective of high levels of anxiety. Also, depression. A lot of the patients that I work with who are feeling depressed sometimes simply don't have the energy or the motivation to take care of their oral health. So some of these conditions really have a direct impact on your day-to-day life.
Yeah, you mentioned these small daily tests. I mean, I know if I'm feeling blue, if I'm feeling down, even getting up to go to the gym or work out. The gym is, by the way, in my apartment, so I really don't have an excuse. But I just feel down and I don't want to do those basic tasks. Is there an age range? So if you were to look at people at the broad population, is it people on the older end of the spectrum that are feeling this way, that are having anxiety, that you're seeing? Or is it younger people, 12, 15, 16, 18, 20 years old?
A surprising side effect of medication is what is known as dry mouth. And dry mouth occurs when the saliva in your mouth is depleted. And this is really important because saliva, when you don't produce enough of it, leads to tooth decay. So if you're someone who is taking medication, it may be important to check in with your dentist and your therapist to see if there is an interaction effect. Several of the medications that can cause dry mouth are antidepressants and anti-anxiety medications. And so this can actually be impacting your mental health more than you realize. Also, when your oral health is struggling, it can also impact or exacerbate your mental health and your quality of life. So for example, if you're feeling embarrassed about the quality of your teeth, it may make you want to isolate more, stay away from other people. You may feel really socially anxious, feeling like people are looking at your mouth, because we do tune into our mouths a lot. We smile, we interact with people. So this may be important to your overall quality of life, checking in with both a therapist and your dentist.
Well, Susan, I need to take a very quick break. When we come back, we'll talk about managing your mental health and your dental health and your overall health. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking this morning to Dr. Susan Albers of the Cleveland Clinic. Susan, thanks so much for staying with us this morning.
Thank you.
All right. So, just to kind of pick up, and a question that I had as we were going to commercial break is, I think medicine's really evolved, and you mentioned, of course it has, but you mentioned how the therapist, the clinical psychologist, the therapist, and the dentist, and even the primary care physician work together. Is that really the approach now? It's not just you just work in your own little tranche and that's it, right? You interact with your colleagues in those other places.
It's true. Having a team approach is one of the best ideas that you can have, because our bodies, our mental health, our bodies are interconnected with each other. So we really want to get professionals in all different areas and working together. In fact, I specialize in eating issues and eating problems. And probably one of the biggest referrals that I receive is from dentists, because our teeth are highly impacted by what we eat. So I often will see people who are restricting their eating. That can lead to tooth decay and problems with your gums. Also, if you are overeating or indulging in certain sweets, sometimes that has an impact on your mouth. And when you are feeling stressed mentally, often we reach for a lot of self-soothing behaviors, such as overeating, smoking, drinking, things that have a direct impact on our oral health. So if you're feeling really stressed and you're reaching to these things, it might be having an impact on your oral health.
All right, Susan, let's talk about some tips. I don't know if they're tricks, but tips to keep you orally healthy, mentally healthy, overall healthy.
Well, step number one is to tune in and ask yourself, how is your oral health doing? And if you take a moment to pause and ask yourself, is there anything about my mental health that may be standing in the way? For example, that lack of motivation or energy. Just simply tuning in and asking yourself, is there a connection between those two things, can be really important. Also, you can work with a therapist and your dentist. Check in with them, let them know how you're feeling. So that is step two. And then number three, as I mentioned before, healthy eating. This is really important for our teeth, has a really direct impact. So focusing on foods that are fruits, vegetables, plant-based, these are all going to be really healthy for our teeth and give us the best option for keeping us healthy, including vitamin D, calcium. All of these supplements also can be really helpful, not only to your mood, but to your oral health.
Susan, I want to ask you, you mentioned clenched teeth in the first segment. And, I think that's something that a lot of people, when they have anxiety, they have I think it's the TMJ. TMJ stands for something. It's a joint. Forgive me, I'm not a doctor. But how do you recognize that? You mentioned about some self recognition, but what about those around you, friends, family, maybe your significant other, if you have a spouse or a partner? They can really help guide you, so you're not alone in that assessment.
Right. Often our significant others, our friends, they can kind of give us a heads up that we may be struggling more emotionally than we even really realize. And you bring up a good point. If you are having difficulty falling asleep, or you wake up in the morning and you're experiencing a lot of tension, you may be having anxiety. And so there are many techniques out there for stress management, relaxation. There are some great apps that can help you to walk you through that relaxation process. So anytime that you're experiencing high levels of stress, it's really important to invest in some of these options to help you to calm and soothe down in really natural ways.
Well, I'm feeling actually very relaxed now. In fact, when we're done this episode, I think I'm going to go, done this segment, I'm going to go rebrush my teeth for the 10th time this morning. Dr. Susan Albers, always great to talk to you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thank you so much.
That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, visit our website and our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.